can lower your levels of copper. But given that you are going to be exposed to this increased risk pretty soon, well worth considering. And of course it goes without saying, you should go and talk to your doctor about all of these things. That's what they're there for, to help prevent illness. Next thing I would say, Gary, is eat a very wide variety of different plants. Now, you're always hearing that one particular plant is good for one particular thing. So, you know, blueberries are supposed to be good for you, and kale, well, they are good for you. Kale, green vegetables, onions, lots of different things have protective properties. But basically, it goes back to the old adage, eat food, not too much, mostly plants. So have a wide variety of fresh fruit and vegetables. Of course, with the fruit, you've got to be a bit careful about the sugar. Certainly don't want fruit juices. If you're having fruit, which is good, have whole fruit. So then you get the fibre and you get the fruit at the same time. That makes it more of a complex carbohydrate, and that means that the glycemic index is lower. So instead of your sugar going up quickly, your sugar will go up more slowly and be sustained for a period of time, which is what you want. So think about your diet, a wide variety of fruits and vegetables. And also, remarkably important in immunity, and this is often missed, but it's a really important point, sleep. Get plenty of sleep. Sleep is vital for immunity, as is good levels of activity within your normal activity ability. But getting good levels of sleep is so important. Now that could be something as simple as turning off all your blue lights, changing your phone to an orange light when it's evening time, putting the lights down in the house, not exposing yourself to screens, you know, like watching videos or something. Don't do that late at night. And go to bed an hour early. Just think about your sleep. And not having big meals just before you go to bed. I find I get regurgitation if I eat a lot before I go to bed. So I don't always do it, but I try not to eat after tea time. Sometimes I get a bit hungry. Anyway, that's my problem. But you know, try and do that. Alcohol, of course, alcohol makes sleep worse because we get this rebound effect. Cut down caffeine late in the evening. All of these things that, you know, can promote sleep, you know, and by the time you get to our kind of age, Gary, you know what's good for your sleep and you know what's not good for your sleep. Now, very well worthwhile having one of these meters in the house, these SATS meters. We've played with these before. So having one of these in the house is usually a good idea. So just get one of those, put it on your finger, and you can monitor your condition. And so these are about what, $20 or something. They're actually pretty cheap. So think about one of those. And then the other one to think about is a simple thermometer. So again, these are probably about $10, $15 from the internet. So keep an eye on your temperature. There you go. So have one of these in the house and one of these in the house. And then it means if you do need to talk to your doctor, it's a simple report, and you can give them objective facts, which is always a good thing to do. Now, the other thing I would recommend, Gary, is early diagnosis. So be aware of the possible clinical features of COVID, and the most likely ones are these. And we've looked at these many times. I'll post them again. Runny nose, headache, fatigue, sneezing, sore throat, persistent cough, hoarse voice. I'll post them all. You can read through these. In fact, what I would do is print them out. Take it from the notes and print them out. So for example, we see that 19% of people who are newly diagnosed with Omicron at the moment get loss of smell. But 3/4 of them, as it's going to be, 73% get a runny nose, headache, flu. So think any of these features. Think, is this Omicron? And of course, you want to have some tests in the house, so you can test and then report to your healthcare providers, to your doctor, if you become positive, and let people know that you have become positive. So early diagnosis, tests in the lateral flow tests in the house. Now, if you get early diagnosis, and because you're in a high risk category, Gary, it may well be that your doctors or the local healthcare facilities want to treat you at an early stage. And for the treatments that we give early, the earlier the better. So if you can recognise that you have, when you get Omicron, and notice I'm saying when you get Omicron, Gary, because I think you are going to, think about those, report in straight away, test as soon as you can. As soon as you get symptoms, a test is likely to be positive. Take the test from your throat as well as your nose, because Omicron often you get higher readings in your throat, and you can diagnose that straight away, and that means your healthcare providers can immediately give you treatments that will make it less likely that you're hospitalised. So, for example, they could take you in as a couple hours and give you monoclonal antibody infusion. That's one possibility. There's evidence that Paxlovid, that's the Pfizer antiviral, reduces hospitalisation. There's evidence that fluvoxamine, the antidepressant, reduces hospitalisation in people that are just diagnosed. So why not talk to your GP now and say, look, can I have some fluvoxamine? It's a common selective serotonin reuptake inhibitor antidepressant. All doctors know about it. Say, could I have some to keep in the house? And then as soon as you tested positive after early recognising the symptoms, you could start taking it. And there's evidence that fluvoxamine will reduce your chances of hospitalisation by 30%. Paxlovid, you might not be able to get that to keep in the house, but if you could get it early and you arrange some pharmaceutical delivery policy, so that's another thing to prepare people around you. Paxlovid is also very good at reducing hospitalisations. If you actually get the acute viral infection, it's probably worth thinking about increasing your zinc, maybe to 50 milligrams for a few days. And also think about your magnesium levels as well. Unfortunately, in Australia, doctors aren't allowed to prescribe ivermectin, but you could ask your GP and ask about that and have a discussion about that. Now, you mentioned, Gary, that you have comorbidities. Now, all your comorbidities want to be optimised before you become infected. So, have you got high blood pressure? Well, take medicines to reduce your blood pressure and get it as normal as possible. Have you got some heart failure? Well, make sure you're up to date with your angiotensin converting enzyme inhibitors to make sure that's as optimised as possible. Have you got chronic obstructive pulmonary disease? Well, make sure that's optimised and you have your inhalers in the house. Have you got diabetes mellitus? Well, make sure your blood sugar levels are as optimised as possible. Have you got chronic kidney disease? Well, make sure you're treating that, optimising the treatment of that as much as you can, taking the medication and avoiding perhaps foods that are high in potassium that might exacerbate that. What is your weight, Gary? I'm not asking, I'm picking on Gary. I could say, what's your weight, John? It's a bit more than it should be. So this is a really good time, given that we're all going to be exposed to Omicron, and given that we know that obesity is increasing the risks of getting more severe disease. And we know this, it's known. Let's lose a bit of weight, let's get ready for this. This is coming. This is an assault that's going to come. I need to optimise how ready I am for it. So any bad habits to cut out, Gary? Take it you don't smoke, alcohol's under control. You know, think about your lifestyle factors that we could optimise at this stage before it's coming. And of course, if you're watching this video in the UK or the United States, you haven't had Omicron already, you could have been exposed yesterday, today or tomorrow, so these things apply to everyone. Have some way of communicating, have contacts, so there's people you know, so when you test positive you can tell your healthcare provider, you can tell some relatives, you can tell some friends so that people know. And do have a supply of your usual medications and food in the house. So that's a few things I thought of. If you followed the UK government guidelines, you'd be waiting to get a fever, shortness of breath and loss of sense of smell to know you had it, which is just laughable. So that's why we keep going over and over. These are the COVID symptom tracker features from a Zoe Tim Spector study. They're the most common ones, so any of those should arouse your suspicion, lead you to get tested. And with all these preventative measures, the earlier you get them, the better. If you get them on the first day that you're diagnosed, the first day that you become symptomatic, you can greatly reduce your chances of hospitalisation compared to taking them on the second day. Now, it's still good to take them on the second day, but the chances of reducing hospitalisation are even better on the first day. It's good to take them on the second day, but if you take them on the third day, your chances of being hospitalised are that much greater, or if you take them on the fourth day. So taking them as soon after diagnosis with this high index of suspicion is good. have one of these in to monitor your oxygen levels, just in case that does become a problem. Take your temperature, although we know fever is only 29%, only 29% of people get fever. Very often the runny nose, headache and sore throat and sneezing come first. So be aware of that, and ask about these early preventative treatments. And of course your doctors in Australia will probably have some other clever things they can do as well, as soon as people are diagnosed, to keep them out of hospital. And then of course if you do deteriorate, then obviously you would need hospital care, but if you do those things, you're massively reducing your chance of being hospitalised. So it's not like the first round where they said go home and give us a call if you turn blue. We've improved hopefully since then, and I'm sure that is the situation in WA as well. Now I was going to go on, I've got some more things to go on and do. Yeah, but I think I'll actually just post that as it is, because that's probably quite useful information, and I don't want it to be too long, because what we'll actually find on these videos is a lot more people watch the first 10 minutes than anything else. The number of people drop off. So we'll leave that because that's quite important information. Thank you for your question, Gary, and stay well, and thank you everyone for watching.
У заказов ясный путь. Познайте Озон Rocket, услуги доставки для вашего бизнеса.
Well, welcome back. It's actually still Saturday the 15th, but it's nearly Sunday the 16th, so we'll probably be watching this on Sunday. Now, a few weeks ago on this channel we talked about in fact it's about 5-6 weeks ago now, we predicted that things are likely to become endemic, and there wasn't too many people saying that at the time, but I want to just show you many other people that have now come on board with this thinking. But before we do that, I just want to flag up some interesting graphics. Now these are from Our World in Data. How do key COVID-19 metrics compare to the early peak, the early 2021 peak, the previous peak? Now these are quite clever because they've taken 100% as being the peak here. So that means that anything above this is higher than the peak in December, January. Let's say January 2021, and anything below that is less, so it's actually quite clever. And not only that, each metric is shown as percentage of its peak value in 2021 and is shifted to account for the observed delay between case confirmation, hospitalisation, ventilation and death. So they've actually taken these parameters and shifted them an appropriate amount. Now they don't say on Our World in Data how much they've shifted them, but we can assume it's about 10 days from infection to any complications, and about 2 weeks to ventilation, and about 3 weeks or more to death. It will be something around there. So what this actually means is we can actually kind of read these that's the link to them there. It means we can actually read them in kind of, I don't want that one, I want that one. It means we can actually kind of read these almost in live time when we can compare all the parameters, because we've actually shifted for the delay. So it's quite clever, really. I must say I thought about doing this myself, but it's actually a bit complicated and never quite got round to it. So I'm pleased they've actually done it. So let's look at some of these now. And this is showing really that the Omicron is so much less virulent. So anyway, they were the cases there in the peak. This is for the UK. So we see that all things went up to that. Well, obviously they all went up to 100%. So we would expect them all to be the same. But now we look at confirmed cases. So first of all, we see that the UK has peaked, but what a high level it peaked at, way higher than previous. And the percentage there is, what is it? 3 times, 300%. But then when we go down and look at the other parameters, the patients in hospital, yes, it's up a bit, but it's only at 50% what it was at the previous peak. Confirmed deaths, round about the 20%, and patients ventilated. Again, we haven't seen a rise in patients ventilated. So all of those way less than previous peaks. Now that's for the United Kingdom. This one is for England, which gives a fairly similar picture for England. Looking at the cases there going up to 250, 260%. And if we look at Scotland, where they did have more restrictions, we find out that with more restrictions in Scotland, they had way more cases. So 250% times the cases in England, and Scotland, where they had actually more restrictions. I mean, if you don't live in the UK, what actually tends to happen here is that the UK government makes particular recommendations, and then the Welsh and the Scottish governments, I think, I don't want to be over cynical, but it looks like they want to be just a little bit different from the English, so they change things a bit. So the Scottish government and the Welsh government had greater restrictions, but they've had massively more cases. So I think the more serious scientific point here is that these increased restrictions in Scotland have actually not helped at all, and in fact the cases in Scotland there are over 600%, whereas in England it was only 250%. So this shows just how transmissible Omicron is, and the restrictions they've put into place in Scotland patently have not worked. Yet there's been all the social and economic inconvenience of that, but they patently haven't worked, because Omicron is so transmissible. As indeed we did predict at the time, it has to be said. Now that's Scotland. What's this one? Oh, this one is Germany. Now Germany was recovering. Germany was recovering from a Delta wave, so some of this in Germany would be Delta, but now it's definitely Omicron. So we can see that the cases now are way higher than they were at the German peak. This is compared to the German peak, which was it was a bit earlier. German peak there was no, it's around about the same, isn't it? It's around about the same time actually. So as we see now, cases going way high with Omicron, and these are going to continue to increase in Germany. They're still in their very exponential increasing phase. But patients in ITU, as Omicron has gone up, so as Omicron has gone up, and remember this is adjusted for the time delay, so as Omicron has gone up, patients in ICU have gone down, hospital admissions have gone down, and confirmed deaths have gone down. And now they are way lower than they were before. So that illustrates there very clearly in Germany. So what we see there is, and again, as we predicted, Omicron is displacing Delta and is associated with less hospitalisations, less deaths, and less patients being ventilated. It's almost as if Omicron is protecting us against the ravages of Delta. Well, it's not almost, almost like that. It actually is that. It's really quite incredible. And we know that Omicron gives immunity against Delta as well. So it's yeah. So whatever you make of that, that's the data. If you don't want to accept my interpretation there, you have to accept the data, I'm afraid, because that's, well, unless it's straight from the Robert Koch Institute. Where's next? That's in Spain. Wow, confirmed cases in Spain, straight up. Not as high as Scotland, it has to be said. Now, cases still going up there, and unfortunately we are seeing hospital admissions, ICU admissions, and confirmed deaths going up slightly in Spain. But there again, they weren't replacing a Delta like they were in Germany, so there's just about nothing there in Spain. The levels are very low, whereas in Germany, without that Delta problem, it was the only place, so the numbers are going down. So even although the Omicron is causing less hospitalisations, admissions, and intensive care ventilations, the sheer volume of cases is having some effect in the Spanish data. Israel, again, massive increase in cases, and again, they've gone from just about nothing. Israel had gone back to Israel had gone back to normal twice, really, there and there. So they're basically going from nothing, as did in South Africa, rather than replacing Delta. So a slightly different situation there. But also but we still clearly see that the levels there are way, way lower than their peaks were. So they're the only countries that our World in Data has actually done in that format. But I thought that was remarkably interesting and quite clever. Hopefully they'll get round to doing ones for the States and other countries now. Now I've had lots of questions about this next point. Dr. Calveri is from the European Medicines Agency. And lots of people have been saying to me that he has said that repeat vaccinations, consecutive boosters, will actually reduce the quality of the immune response. Now, he did have a video that was taken down from the European Medicines Agency. This is from a press conference. So whether it was on that or not, I don't know, but that's taken down. What is available now is on these sites here. And so what's available now that Dr. Calvera has said, this is what he's currently on record as saying, but whether he's backpedaling a bit, we don't know, because I couldn't get to the original video that I wanted. But here he's saying boosters can be done once, in other words, the first dose, or maybe twice, that would be a fourth dose, that is not something we can think should be repeated constantly. So he doesn't actually say there that the immunity is reduced. So it leaves that possibility open, but he doesn't actually say that multiple vaccines have an immunosuppressing effect. As I say, if he does say that, it's no longer in the public domain. We need to think about how we can transition from the current pandemic setting to a more endemic setting. Yes, of course. We agree with that. With Omicron, there will be a lot of natural immunity taking place on top of vaccination, and this is, of course, true. So it looks like there's going to be, well, there is huge amounts of natural immunity following in the wake of Omicron. So will that mean that future vaccinations are unnecessary? I would very strongly hope that is the case. I strongly suspect that is the case. So he is agreeing with that. We will be fastly moving to a scenario which is close to endemicity, becoming endemic, in other words. These are direct quotes. English is his first language, so it's pretty good. Fourth dose for all, data has not been generated to support this approach, so he's not saying here, he's not actually saying this hampers immunity, he's saying there's no data to support its efficacy. A repeat vaccination in a short time frame will not represent a sustainable long-term strategy. So he's saying it's not sustainable long-term. From this, he's not actually saying that he's actually immunosuppressing to have extra doses of vaccine. I was asked this on a TV interview recently. The guy said, do increased vaccines actually have an adverse effect on immunity the same way as you can get antibiotic resistance? And I said, well, as far as I know, not. But then lots of you wrote in and said, is this what this guy is saying? This doctor from the European Medicines Agency, the vaccine doctor, Dr. Calveri, and from what we have in the public domain now, no, it's not what he's saying. It's just saying it's not a practicable way forward, and there is no evidence that it would be beneficial. So that is what is in the public domain now. If it changes and he comes out and says it actually harms immunity to have further vaccine doses, then of course that would be something we'd take an interest in. Now, the endemic COVID very soon thing that we've been talking about for 5-6 weeks now on this channel, we're roughly on the time scale we suspected we were on. Very soon, basically we've peaked already in the UK. United States will be peaking in the next couple of weeks. Doesn't mean say hospitals aren't going to be a problem going into February. They are in the United States especially, for reasons we've already looked at. So Omicron is going to become endemic, at least for the next few seasons. Now, endemic means it's consistent and predictable, not what you might... So you want it to be consistent and predictable as opposed to the boom and bust we've had lately. So we're not quite there yet because it's not totally predictable.